We are now going live and we will take all your questions pertaining to the 2021 match season. So, this season has been very unusual in the sense that there is this COVID-19 situation, and we got a lot of questions from IMGs in terms of the CS postponement, other exams postponement, and what can they do, what should they be doing now. So, we thought we'll take it one by one. So the first question that we received was that the CS has been postponed, and if it is delayed, then should I apply without CS on September 15th, or should I wait for the CS exam results and apply with a complete application? So the answer to this is even in a normal season, if you had a 240 plus, say, on both your steps and you are a recent graduate, you can apply without CS. Preferably, of course, we do want everyone to apply with all three exams, but it depends on the profile also. So you can apply without CS if the situation is such, and if your profile, say recent graduate 240 plus, that's for sure. You will get interviews. It may be less number of interviews, but the situation is such that the programs uh, will give you a lot of latitude, hopefully this year, and you should be able to apply without CS if other pieces of the profile are okay. Then the other question we have received is around rotations. What can I do? How do I get rotations at this point? And the answer to that is two things. One, there are still rotations in the US, mostly in the clinics. Other than the hotbed areas, there are some rotations going on. Like in cities in the south, there may be rotations. The hospitals have stopped these rotations, so that's a bummer. But there are rotations in some of the southern states that are going on. The other thing you could try is tele rotations. Many of the physicians are offering tele rotations, so those could be something that you could try. Uh, but remember that these rotations will come up in July and August again. Everyone expects this to be over. Hospitals will be eager to get back. So July, August will again be the time when these rotations should come back. And the other thing to note here is, in addition to the telerotation, your home country work experience, if you're outside US, at this point of time, all physicians are working, they're fighting, against this coronavirus. So home country experience is going to be very, very valuable in this season. You should, if you are hopefully certified in your home countries, licensed in your home countries, and if you are there, you should go out and work. Those experiences, the work experience for a change, home country work experience, is going to be very, very powerful in this season. The other thing you can do in this season is volunteer work. Again, uh, because of the lockdown in a lot of countries and even in the US, the physical volunteering, giving back to the communities, may be limited. But there may be opportunities for you to do something digital or somehow contribute. Maybe it's the Red Cross, maybe join some other organizations. uh, that would be really helpful. Remember that this volunteering activities will come up a lot for discussion in the interviews. Volunteering activities may not give you the interview, but during the interview, this thing is going to become very big this season. You will be expected to have volunteered, to have demonstrated, that you have contributed to this fight against coronavirus. So that's one thing, just to keep in mind. The other question we are getting is around research. What can we do around research? How can I contribute or improve my profile? And the reason is, like, the universities here are closed for all practical purposes. They are not hiring J1 scholars. So in a traditional season, you would see a lot of IMGs joining the research scholar program at, say, Mayo Clinic, Cleveland Clinic, Harvard, on J1, doing the research, improving their profile. So what can you do now? The best chance is still going to be if you have done some case reports with your attendings, if you have rotated with people in the past, ask them for help, ask them if they need help. Everyone is trying to publish something around this COVID-19. So ask them, get in touch with people you have rotated with. You can still get in touch with the university faculty. You can still send out emails to see if they need help. But in this scenario, most of your help is going to come from people you've already worked with. So if you've worked with the folks, they are more likely to give you some research projects. The other thing, of course, is even in your home country, right? If there is sufficient data for a literature review, for a review article, things like that, this would be the time that you should be getting into research. Again, the university-based research can be hard. They're not hiring. It may open up in July or August, but there would be these opportunities that you have to create for yourself, whether it is your seniors, whether it is your attendings, whether it is other people that you've worked with, case reports, review articles, even original research yourself. And our students have been doing this now, so this would be the time for you to get into some of those original research kind of ideas that you have. In fact, over the past month and a half, COVID-19 related publication have just skyrocketed, as you can all imagine. So there are things that can be done, and especially in research. In general, let me text here, research positions. How do you look for research positions? How can you find and use that for uh, our match? We did some videos, so I'm just gonna put some links out there. There are certain other links that I can tell you. In general, COVID-19 and how to prepare for match. Also, we had some ideas here, so you can look at these. This is hard, but so far what we have heard from ECFMG, there are no changes. In other words, the season is planned to go as scheduled. There could be possibly a delay, but as of now, seems okay. Everyone is planning for the season as usual. So the other question we are getting is, how will this season be different? Will the programs uh, lower their criteria? What do I think will happen? So very hard to say whether programs will dilute their criteria. And the reason is, at this point, it's uncertain on how the June, July, August will go. Some electives obviously have been canceled, but things may get back to normal in June, July, August. That's one. And second is, there are already IMG applicants who would have completed their rotations or who may already be in the US. So these applicants will continue to improve on their profile. So hard to say whether programs will dilute their admission criteria. It is possible that they are more lax with the application review, or the when they are reviewing the application, do they really want all three exams. So, like I said, maybe CS is something that they can ignore if you don't have CS. But in terms of the scores, in terms of the general criteria they have to invite you for interviews, that is unlikely to change. Some of the other logistics could change, in the sense, if we continue to have COVID-19 related issues or travel issues, maybe some programs or a lot of programs would go for a Zoom or a Skype interview. In fact, there are new programs right now which are interviewing next week, and they're inviting applicants just over Zoom. So some of those things could change, but hard to say that overall anything in the criteria itself for admissions would change in this scenario. The other question we got: how and when to start working on the MSPE? What volunteer experience can we do to improve our CV in this situation? So that's again a great question on MSPE. Like I said, this season would be different. And in this season, anything and everything that you can do to enhance your profile would be of an advantage. And historically, MSPE, which was called Dean's Letter for IMGs, was not that important. Applicants and programs didn't really care about MSPE. It was a required document, but wasn't really paid much attention to. However, in this season, as more and more IMGs are not in the US and they cannot do these rotations, increase their profile, MSPE will become important. Uh, so try to follow the directions, try to follow the format for AMG programs, and we can post those links later in terms of how an MSPE could be structured. We also had a couple of blogs earlier in terms of the language that you could use in MSPE. So, Dr. X was in the top X% in the class, or things that are very quantifiable that typically a program would look for in AMG applicant. So MSPE in this season is going to become very important. Historically, like I said, IMGs have not paid attention to it. I think in this season, you should pay attention to it, and now would be the time to work on MSPEs. There are standard templates that you can use, but make sure the value you've added, the quantifiable measures in terms of your rank, in terms of the various subjects, how you have performed, that comes up. So that's something that is one of the advice we have for MSPE. In terms of volunteering activities, like I just mentioned, this would be the season when volunteering actually becomes more and more important. Any and every volunteering around COVID-19 is going to be reviewed by the programs. They will be interested in knowing what you did, how you maybe led a team, how you showed those leadership activities, and perhaps how you even contributed. And it need not be that extensive, even Red Cross, right? So few of our students have started an initiative on Facebook. You can see their page. It's called Crush Corona. So they are writing articles, they are producing infographics, they are reaching out into their communities, and those kind of things will always help you as you get to the volunteering part of this. Let me read some other questions. What is a good step 1 and CK score for pediatrics, and for a non-US IMG, how much USCE is required? So again, things, even in this season, if you go by the USCE and things in past, you will see that at least if you're a recent graduate, 3 months or so of USCE is very preferable. And in terms of your scores in pediatrics, 230 plus in both steps is highly desirable. And of course, the LORs, the quality of LORs matter. It should be specialty specific LOR that you should be using. In fact, we do have kind of free resources, kind of calculator that you can use to assess your match probability. So let me just put it here so that you can use this tool to assess your match probability. So here's the match probability which you can use. Um, uh, so that's on the various specialties. Let me also read other questions that we have gotten. What can I do to improve my family medicine residency resume? So, like in any specialty, even FM looks for specialty specific experience, specialty specific LOR. So, the first thing you need to do is to get those kind of experiences. Family medicine is a slightly tricky specialty. They really look for people who have shown passion around, say, primary care, preventive care, women's health, and they have been moving away from doing visas. So, as a visa requiring IMG, it is tough to get family, or it is getting tougher to have a family medicine residency match, but it's not impossible, especially if you're a recent graduate. Score wise, they are fairly lenient, but they do want to see a lot more experience and passion that you have around family medicine. And all specialties, including family medicine, are looking for specialty specific LORs. I cannot stress this enough, that specialty specific LORs are becoming more and more important. And this is where you can, improve your specialty specific profile. So if there are questions, you can ask, and we will be able to answer it. I'm here. I think some of our math students are also here. Then this is again a good question. I have LORs in a certain specialty, for example, internal medicine. Can it work for pediatric or family medicine? Again, specialty specific LORs are going to be very, very important. So let's say you got this IM LOR, and it is okay for the physician, for the attending, obviously, to comment on your clinical competence, to comment on your teamwork skills, and how passionately you deal with patients. That's all great. That can be worked in any specialty. However, if the LOR mentions specifically, for example, that you want to be in adult hemonc, in GI, or very specific to IM, then you should not be using it in pediatrics or any other specialty, because that can boomerang. We have seen it over and over again. The careful use of LORs is very important. Every specialty wants to see a specialty specific LOR. Now, what you could do in such cases is you could get two LORs or multiple LORs from the same physician if it is possible, and one LOR could talk about your interest in IM or one of those subspecialties, and you can use it for IM programs. And the other LOR could talk about your interest in, say, pediatrics or family medicine, and you could use it there. The next question is step 3 necessary for IMGs? Again, It all depends on your profile, the if step 3 is necessary or not. So let me give you one example. It's profile, it is specialty, both. So if you're a recent graduate and you have decent good scores, 240 plus, even if you need visa, most specialties will be okay with you without step 3. um, Step 3 is more needed, of course, in addition to your need of visa, for which you can take step 3 by December or January if you want H1B. But step 3 is more of a requirement. If you have certain red flags, so you may have an older year of graduation, you may have lower scores, you may have some gaps. It is very okay, and I think it is expected that you take step 3. Certain specialties like psychiatry are more and more expecting step 3, right? But we get a lot of students who are 250 plus recent graduates, and I tell them step 3 is not required for you. So, in terms of hierarchy of your profile and what programs will expect of you in step in your application, let me put it this way. So, at the top, of course, are the scores. So your step 1 and CK, those kind of scores, they are very important. Year of graduation, which you cannot change, of course, also plays a role. Assuming that you can get all these exams on time will be good, but like I said, in this season it may not be possible. Now, what after the exams? After the exams, it is electives, it is those hands-on rotations that become important. And when it comes to these rotations, electives are higher than, say, externship and observership. So there is this hierarchy. Quality of LORs is absolutely important. When I say quality, it means the LORs have to be very, very specific. They have to be very customized and personalized. Generic LORs are not going to help you. What do I mean by this? I mean that the attending or the physician should be able to highlight specific contributions. So, on a daily basis, you did, for example, 20 history physical, you made the management plan, you presented these cases. How did you counsel the patient? How did you actually deal with difficult families? In HEMONC, for example, if you've been doing rotations, did you or were you involved in end of life discussion? So those very specific things are important in the LOR. So in terms of, again, the important scores, electives, if you can do it, other rotations like hands-on rotations are important, observerships are important, and then it's also important to look at some of these brands and names. A rotation at, say, Cleveland Clinic, Mayo Clinic, Harvard helps, right? Absolutely, those brand names, those letterheads will help you, right? So what do you do after rotation? After rotation comes, if you've covered these things, right? Let's say you've covered your rotations, you have your scores, what else? Then you can start thinking about research. Research is obviously important, but in terms of the hierarchy, research becomes important after you've covered these other things. And even in research, outcomes are important. 1 month research is hardly going to help you, right? So they look for an extended kind of a duration, 3 to 6 months or more of these rotations. Uh, they are very helpful. Obviously, it helps to publish. Now, remember, publication takes time, especially if there is original research, especially manuscript writing, and sending it to the various journals and getting it accepted takes time. But there are other ways, right? You can always write case reports, you can write review articles, you can even send abstracts to these conferences. Most of these conferences actually have deadlines in June, and our students have been working towards sending them posters and some of these presentations. So research becomes important, and then you come to step 3. The importance of step 3. So the point here is make sure you have your step 1 and CK under control. Those scores are good, but whatever they are, you cannot change it. Then you talk about your electives if you can do it, rotations if you can do it, then possibly research, and then yes, step 3 to overcome some of those uh, flags that you may have. And as you move away into older year of graduation, the importance of step 3 becomes important, just like the criticality of some of these things. The more rotations you have, it is better. More research, all this as a portfolio becomes important. Okay. uh, should I mention my low score in step 1 in the personal statement? Now, these are some of the other questions we get, as I write my personal statement. Should I mention my low score or a failure in the step exam, things like that. Uh, so it's not an easy answer. The entire personal statement and the entire profile has to be seen before we can comment whether yes or no. The short answer is it depends. It works both ways. People mention it, or people may not need to mention it. But the way to look at it is to see how you can portray your learning. How this has contributed, whether it is a step 1 low score, failure, or any other setback in life. How has that made you a better human? How has that made you a better physician? And probably how has that made you better equipped to start the residency? So think of it in ways that can convince the program director, convince the committee that yes, in spite of the failures, you've been able to learn from it, and you've been able to use those learnings to help your patient population to contribute to the teams. Let me see. Will a drop of 15 scores from CK, a high score of CK of 250 or so, to step 3 have a negative impact? In general, a step 3 score of 230 is considered excellent. It's a very good score. So no, a drop from, say, a very high CK score to a step 3 score of 230 is not going to be that worrisome. Don't worry about it. But yes, if you have lower scores in step 1 and CK, let's say 210s or 220s, then try your best to get a very high CK score. The CK score of around 200 or low 200s, when the other scores are low, is going to be not that good for you guys. So what else did we get? If some programs have a score filter of 220 or so, or 230, is it wise to apply to those programs with less than, say, that baseline score? So again, this is a very common question we get. Let's say the minimum requirement score for for a program is 230, you have 220. What you should do? So what I'll tell you is, you can go out to the programs, you can reach out to them, you can check with them. A lot of times they will be okay, and I think especially in this season they may lighten up these requirements. If not, I think it's very okay to take a plus 10 kind of an approach. What do I mean by that? Is if you have 220, if the score requirement is 230, you should go ahead and apply, unless of course there is a financial implication to you. You are really tight on money, then of course you have to see, check the program, email, call them. But in general, if you have the finances to apply to reasonable number of programs, it's very okay to take the plus 10 approach. If your scores are within the 10 points of the program minimum score, go ahead and apply to that program.